without further ado, I want to introduce who will be giving statements to start the news conference. And then we have three other folks here who will be available for questions as well. But first is Timothy Thornell. He's our Chief Executive Officer and President of our health system. Dr. Chu is an infectious disease specialist and one of only a handful in the state of Wyoming. Dr. Jessica Hughes is our Emergency Department Medical Director. We have Erica Hansen in the mauve jacket. She is an infection preventionist at Cheyenne Regional Medical Center. And then Robin Rolling is our Chief Operating Officer for our health system. And then we also have, want to welcome Kathy Emmons, is sitting at the next table. She is the Executive Director of the Cheyenne-Laramie County Health Department. Next to her is Caitlin Lovelace. She is also an infection preventionist for our health system. And then Landon Smith is a clinical manager in our emergency department. So without further ado, we'll get started. Again, each of these folks will be giving a statement before we open this up for questions.
Great. Thank you, Kathy. Again, my name is Tim Thornell, President and CEO at Cheyenne Regional Medical Center. Thanks for joining us this morning to talk a little bit about COVID-19 or coronavirus. And really our goal, our aim this morning is to share with you information that's happening locally. We know there's a lot of information out there from CDC, and we get a lot of information from them as well. From the State Department of Health, we get a lot of guidance from them as well. But here today, we're just talk about a little bit about how to access care locally, what we're doing on the home front in Cheyenne and Laramie County to address the situation that we're all faced with, and how we are preparing and have been preparing for this for some time now. I think first to start off with is certainly we've been working with a lot of different agencies throughout our community. We've been meeting for the last several weeks with the city, the county, the state departments of health and different officials and other groups such as school districts, and how we can work and collaborate together to make sure that we're all on the same page in our actions and how we're working through this, and that we have to work collaboratively. And that's what we certainly find is our best efforts will be done in collaboration with one another, and our most impactful preventions will be done in collaboration with one another as well. As a hospital, we are always in readiness state, if you will. We do emergency preparedness on a routine basis. Virtually every quarter we have some fashion in which we do an exercise for emergency preparedness. So the general concept is nothing new to us, and we constantly work towards this. And so we have plans to this end. Now, every situation presents new and unique nuances to it. So with COVID-19, we have certainly taken our existing preparatory plans and adapted them to what we're facing today. And what you'll hear from some of my colleagues up here is specifically how we are adapting our plans to address specifically COVID-19, how it spreads, and how we can best work with our community partners to mitigate what may happen in our local community. But our plans are very scalable, and what you will also see is things that we have implemented today in terms of, we'll talk a little bit about our visitor policies and how it's just prudent for us at this time to kind of restrict some of our visitor privileges. So again, kind of speaking to the social distancing component of things, and also recognizing that we are very fluid and adaptable in what's happening. So our policy today may very much change in a week's time, and we may have to implement some more detailed precautions with regards to visitors as an example as time progresses. Always want to remind everyone, and hopefully you'll hear this a couple times from us today, some things that everyone can do. So we're asking certainly all of our employees who work at our hospital and health system to be leaders and to emulate best practices, which include great hand hygiene, washing your hands frequently, ideally with soap and water. If not, hand sanitizer is great. Covering your nose and mouth when you cough, preferably with your elbow or with a tissue. Avoid touching your face to the extent that you can. Of course, the more we talk about it, the more likely you want to touch your face. But to the extent we can, and add that to our mannerisms to not do that. And then social distancing, avoiding crowds to the extent that we can, avoid large gatherings. As by way of example, here at the hospital, we have times where we have meetings that are 100 plus people. So for the time being, we are curtailing our meetings that come together in that large mass and electing to do conference calls in lieu of that, even if we're all calling in from, just a mile or so less away. So we have examples of all those things that we can do on a routine basis, and just slight modifications in our daily routines can have a powerful impact on mitigating what's happening with the transmission of COVID-19. And the last piece is, certainly as people are not feeling well, whether you exude symptoms related to COVID-19 or not, but staying home to the extent that you can, and again, not getting out and potentially transmitting things. And I guess the last comment I'll leave you with, and then I'll ask my colleagues to comment as well, but we remain very agile and adaptable to what the situation is. So very important to know that we expect things to change over time, not necessarily because things are getting markedly worse, but just because we have new information coming in and new protocols that we will be following and adapting to and working with the situation as it evolves real time. So again, not necessarily cause for alarm as we augment and change some of our policies and practices over the course of the next couple of weeks or months. With that, I'd like to ask each one of our panelists up here to talk a little bit about some of their areas of expertise. So immediately to my right is Dr. Chu. He is board certified in internal medicine, but has specialization in infections disease and is our full-time infectious disease medical director. So we're really pleased to have him on board, on staff, in our hospital and in our community. And so he's been on the forefront of this from the very beginning and in contact with our public health agencies locally and throughout the state, and does a phenomenal job of helping us interpret federal guidelines from CDC and the state departments. So with that, Dr. Chu.
And I'm sorry to interrupt, Dr. Chu. We did have a journalist who's in remotely by audio only. So if before you give your statement, which Tim just introduced you, so that's fine, but say your name and title. That way he knows who's speaking. So I apologize for interrupting,
no worries.
but that way he knows.
Good morning. Thank you, everyone, for coming. Thank you, Tim, for the kind introduction. And my name is Hu-Feng Chu. My specialty is infectious diseases. I assist Erica. We work and Caitlin pretty closely together at CRMC. So back in December, I just want to give a little introduction on the virus. Back in December, there was this atypical pneumonia that was presented in Wuhan, China. Initially, the name was called the novel coronavirus because novel means new coronavirus, because in general, kids do get coronavirus upper respiratory infection. And this is a little different than the regular viruses we're seeing. And then finally, the genome was typed to be a type of virus that was similar to the SARS virus and the MERS virus, and the name came out to be SARS-CoV-2. So that's the name of the virus, and the disease it causes is called COVID-19. And that's where the name started, and we're able to label the virus, etc. Some of the symptoms of the virus usually is fever, cough, shortness of breath, and the 80% or more than 80% of patients will have very mild symptoms. Only 20% of patients will require further medical treatment, which may include certain form of either oxygen therapy or supportive care, or may require attention in the hospital. Other major questions that I came across is also, what should I do if I have these symptoms? You want to call your doctor and get evaluated to see if you are stable enough to stay home. For example, if you're not having very high-grade temperatures or not severely lots of chest pain, you may be able to be stayed home and monitored. There is CDC guidance on patients who are stable enough to be monitored. However, if symptoms do progress, please contact your provider to be evaluated further. In addition, patients who are positive for coronavirus, we recommend patients to stay home, and as Mr. Tornell said, is also do quarantine for 14 days. That is very important to prevent the spread of transmission, and also, as you mentioned, the social distancing is very important. And I think that is a technique that epidemiology and public health have been using to break the chain of transmission for the virus. And it's actually saved lives. Social distances does save lives. So it's important for us to be protecting not only your family, but your friends or the immunosuppressed population. And other main concern is also, for example, if a family member is positive for COVID-19, it's also important that the household consider to be quarantined also for the 14 days and consider getting tested. Possible is to use separate bathrooms, have in a separate part of the household will be very important. I think that's anything else.
Okay. Yeah. Right. Thank you, Dr. Chu. Dr. Hughes is emergency medicine board certified and trained, and is our medical director for our emergency department. And as you can imagine, one of our main access points to healthcare is our emergency room on a routine basis. And certainly as we look at patients presenting to the hospital with potential COVID-19 symptoms, the ER will continue to be a focal point for entrance into the hospital. So we thought it'd be nice to have her talk a little bit about how to access healthcare right here in your local community and kind of the protocols for going through the emergency room.
Hi. So I just wanted to go over kind of what we've been doing to prepare in the emergency department. We've developed a process and for diagnosing and treating patients that are suspected to have COVID in the emergency department. Like Dr. Chu said, the most important thing is if patients have mild flu-like symptoms, fever, cough, that we ask them to stay home and stay quarantined to reduce the spread of infection. If a patient is concerned and they feel like they need to be seen in the emergency department or they need to be admitted to the hospital, they're more than welcome to come to the emergency department. We're asking people, if they are going to come in to see us, that they call ahead and they call the main hospital number and just give us a heads up. That allows us to be more prepared and take the proper precautions. It helps us ensure the safety of all the other patients that are here and all of our staff as well. So basically, when a patient presents to the emergency department, we're asking that they come in through the main ED doors and not walk through the hospital. Again, trying to reduce the spread of infection. We have a stop sign in triage that asks people if they have a fever or a cough that they stop and they push a bell. This alerts us that they're there, and we'll go out there and meet them and put a mask on them. Throughout all of this, we're going to be wearing all of our own personal protective equipment so that we can reduce the spread again. We have created 2 designated areas in the emergency department for patients that are suspected to have COVID. One is for critically ill patients, and the other is for non-critically ill patients. So our process, once we meet them at the triage area at the doorbell, we're going to take them back and do testing. If that testing comes back negative, for example, we're going to test for the flu and things like that. If that testing comes back negative, then we're going to be calling the Wyoming Department of Health, and they're going to help guide us on who needs to be tested for COVID and who doesn't need to be tested for COVID. So we're committed to caring for our patients and community. We've worked really hard to create these protocols and designated isolation areas so that we can keep patients treated appropriately and tested appropriately, keep our staff and community and other patients safe and protected from being exposed.
Great. Thank you, Dr. Hughes. And then next is Erica Hansen. Erica is an infection preventionist at Cheyenne Regional Medical Center. And I will say we did not just create this position because of COVID-19. We've been concerned about infections for many, many years. And this is a position that we've had here for quite some time as it's relevant in any healthcare system. But just today, she gets to come to the limelight and share a little bit more about practically what we're doing here at our hospital throughout our medical system, our clinic network, and then share a little bit about, again, how you can apply some of those tactics and techniques every day at home.
Thank you. Hi, everyone. So we do prepare for events like this. We have personal protective equipment that our staff is trained to use. We do make adjustments in a case like this illness, as recommended by CDC. Good hand hygiene is imperative in the hospital, and I think that's one thing that people really can help take control of at their own household. People want to feel like they're doing something to help themselves, and that really is one of the best things you can do at home. And good hand hygiene. Now is the time to maybe have that hand sanitizer in your car for when you leave a public place, and then when you get home, you're doing the 20 seconds of hand washing, you're getting in between your fingers and you're doing your thumbs, things like that. That is the first thing we can all do to take control of this. The other things people should consider is that social distancing. I know spring break is coming up. Look at the travel alerts, look at your household. The recommendations out there from CDC are 60 and older and some other health conditions to really think about mass gatherings. Look at that, evaluate it, see if that's right for you, and make decisions based on that. I think that we are most definitely here to take care of patients, but we really want to prevent lots of people getting ill. We want to keep our ER staff at full capacity because there's other emergencies going on. So everyone in the community can play a part to really take control of what's happening right now. Additionally, CRMC is implementing some more visitor restrictions, like Tim said. 2 people at a time for certain locations, nobody 12 and under, and those most at risk at the moment, and this is very fluid, would be oncology patients, mother-baby patients, cancer center, and am I missing one more? And ICU. Yeah, those are the patients that are most at risk for a complication. We will definitely be evaluating that really daily and can expand that, and we can bring it down as well based on what we're seeing in the community. So thank you.
Great. Thanks, Erica. And then I'd like to introduce Robin Rolling, registered nurse and our Chief Operating Officer here at Cheyenne Regional Medical Center. And I'm going to ask Robin to talk a little bit about, we've talked a lot about what we're doing today, but again, as this is always evolving, kind of give us a little foresight into what we may expect to do in the next couple of days, weeks, months to come.
Thank you. Hi. So our team has been meeting. We have a multidisciplinary team that meets currently 3 days a week. And we utilize the Incident Command System, which is a national federal program that many hospitals have already incorporated. And so the beauty of that structure is that we can scale up or scale down. We've been utilizing that process to address things not just now, as Tim indicated, but also for our future. So, for example, we are consistently looking at how about our communication, both interior and external. What kinds of things do we need to be doing? We look at our resources and assets. So, what I mean by that are things like where are we in terms of our supplies, and how will we be looking at our supplies in the future? What kinds of things do we need to be thinking about in terms of our workforce? And how do we make sure that we're maximizing and keeping all of our folks safe so we can be really well prepared and providing the best care that we can for our community as a whole? And we also think about things like safety and security and our utilities. How are we addressing pressurized rooms, which is what we want to utilize to keep patients safe and staff safe as well, and then cleaning practices, those kinds of things. We've also been working very closely with our partners through Laramie County Public Health and other providers to think about moving forward as testing becomes more readily available. What kinds of things can we be doing as a community to provide a more open testing process? At present, though, I just want to reiterate what Dr. Hughes had indicated, that if our current practice is that if the if someone's got a fever, their flu test is negative, then we do contact the Wyoming Department of Health, who really is the group that helps direct whether or not we move forward with the COVID-19 test. So we're doing that in cooperation with both the county and the Wyoming Department of Health.
Great, thank you. Kind of put us back to where we are today at Cheyenne Regional. We have had 2 patients present over the last handful of days, probably the last 7 days, whom we've tested and come back negative. We are available to test other patients. I think we may be testing a few currently, most of whom have low risk indicators. So as we testing patients will become a little bit more routine as time progresses. So we do not envision announcing every time we're testing a patient. However, should ever someone test positive, you'll hear certainly first from the Department of Health, as they'll get that information first and share that out. And if it is locally, then we will respond as well and share what changes we may make to adapt to that transition in the situation. We're also prepared in the sense of recognizing that we are one of the largest healthcare facilities within the state. And with that, we're prepared to help and assist other hospitals, smaller critical access hospitals that are near and proximate to us, and be able to absorb patients from other areas. And as Robin, mentioned, our emergency preparedness plan, again, is quite scalable. So while today everything is manageable quite nicely through our emergency department, there may become a time where it exceeds that capacity, and we have capacity in other departments. And in fact, we have some vacant space presently that we can, quickly adopt and adapt and take care of quite a few patients if the need should arise. Now, we obviously hope it never gets to that point, but we are prepared to scale this up, very quickly and to a fairly large extent should that need ever arise. So with that, we're happy to answer any questions that anyone may have.
I would just ask if you would, I think most everyone here knows our journalist, but maybe introduce yourself and which media outlet you're from. Thank you.
We have some questions from us, and then we've also got some questions from readers or for social media. So one thing that people are concerned about is, Margaret Austin from the Wyoming Tribune Eagle. Some people are concerned about their mail. Are there any risks with that? And, the virus transmitted that way?
I believe that's considered a fairly low risk. Obviously, at this time, COVID-19 incidence is low, so I would say that's a very low risk at this time.
Isabella Alves, I'm also from the Wyoming Tribune Eagle. This was also a reader submitted question. So basically, in this situation, what this individual is concerned about is that her son had influenza B, and they found out that the flu shot this year is only about 45% effective. Obviously, please fact check that if that is to your knowledge. And that does the low effective rate of the flu shot have any effect on the contagion rate of COVID-19? And do those things kind of play hand in hand with COVID-19, with maybe more people being at risk for getting the flu with lower immune systems?
I think the flu and COVID-19 are 2 different viruses. So the influenza vaccine itself does not protect you against COVID-19. It's 2 separate viruses. Obviously, risk factors for COVID-19 do share some common risks for influenza infection, such as age greater than 60, uncontrolled diabetes, heart failure, or uncontrolled COPD are some of the major risks.
And then Margaret Austin again with the WTE. Does Cheyenne have a greater risk as a freeway intersection? The highways?
Maybe that's a public health question.
That's a great question. That's not something that we've, I don't think I've heard anybody at the state talking about. From just a basic perspective, though, I mean, you're going to have more traffic coming from different areas. So as the incidency in Colorado increases, it certainly could have more exposure in Wyoming.
And if anyone else wants to jump in, this is another user-submitted question. So, with hand sanitizer, soaps, just basic disinfectants being sold out of stores, how can people, are there any home ways people can disinfect and, keep washing their hands if they don't have access to necessarily commercially available soaps or?
Yeah, I think that's a very good question. Hand sanitizer are obviously, as you said, very hard to get. However, CRMC looked like we have some here for you guys. So you want it to be 60% alcohol-based hand sanitizer. That helps to kill the virus itself. You mentioned about home-based. Again, there's proposed isopropyl alcohol mixing it with other components, but I would say any EP, washing your hands is the most important. Soap and water, even though it's inconvenience, it is the best method for cleaning your hands. And I just want to comment, we should not, preparing for COVID-19 is, you should not stockpile, because there's a point where if you do stockpile, it's putting others at risk, and eventually that risk is going to come back to you. And as the comment said, it's hard for others to get hand sanitizer. That leaves the population who does not have the hand sanitizers unable to perform hand hygiene. They may touch a surface that is infected, and then that leaves the people who has hand sanitizers probably at risk too. So I think it's very important to prepare and don't over stockpile, quote unquote stockpile, because we are in this together to combat COVID-19. Anything else you want to add, Erica, as part of infection control with hand hygiene control?
I think you can use any soap. If I was totally out of soap, I'd be using my dish soap. So I would go that route. I'm surprised we haven't gotten a mask question, so I'll just say wearing a mask in general public is not necessary. And it gives people a false sense of security. And if you have not used your hand sanitizer and touch your mask, you've contaminated your mask and your face more. So wearing a mask just in general public is not protecting you.
And while we did receive a lot of good questions from our readers, a lot of people were, saying, oh, this is being blown out of proportion, it's no worse than the flu. So what would you say to the people who maybe aren't taking this seriously?
That's a very good question, very common question. So I think there's a number of points to know how this is a little different from the flu. One, the influenza vaccine. There is an influenza vaccine available for the flu. Number two, there is antiviral therapy for the flu. So there is a prevention method for the flu and a treatment available for flu. The third point I want to raise is it's more infectious, meaning that if one person is infected with influenza, that it can multiply to only one other person. And this is just a factor of multiplication in terms of the numbers. For COVID-19, it's one person can transmit to 2 to 4. So that's a factor of 2 to 4. And that makes it more infectious and transmittable. And I think that's why social distancing, we have to make it a thing or a hashtag to save lives. Because we need to break that transmission of the virus. And that's what we are all here to do. We are all in this together. And even though our lives are going to change for the months to come, we need to save lives. And we can all do this together.
Another question I have. So, U.S. Representative Katie Porter, during, when the CDC was making that presentation to Congress, she questioned the CDC director, and essentially the CDC director said, yes, they'll make sure Americans get COVID-19 testing for free if necessary. Have y'all heard any of that trickling down y'all's way yet?
I know.
So I would say at present, what I am aware of is that there has been some guidance from the Centers for Medicare and Medicaid Services that Medicare will cover the cost of the specimen collection. And my understanding as well is that the state of Wyoming is covering the cost of the actual running of the test for the COVID-19 at this point.
The one caveat with that I think we need to be clear on is that the tests that are being run at the state lab, the state is paying for. If a physician or provider would choose to have it run at a private lab, that's outside of what the state has set up at this point.
So Sean Boyd with KGW, and so for the mass, right? If we're only sending the test to the laboratory, the Wyoming laboratories, correct? Will there be any tests that will arrive here in Laramie County? Will we be able to test here instead of having to ship it off and wait 48 hours somewhere else to get the results?
So at present, if a sample is collected here in Cheyenne, we take that specimen and get that to the Wyoming State Lab. If the test is completed and sent to, or excuse me, the sample is completed and sent to the state lab before noon, we typically have the results later that same day, about 4 or 5 hours later. If the sample is obtained after noon, we typically will have those results the following day.
So I think, Robin, our state lab is here in Cheyenne. So we're fortunate in that the state lab is here present. It is in Cheyenne.
Oh, it is in Cheyenne.
Yes.
Okay, so then that's a game changer right there.
Mm-hmm.
All right.
Wyoming Public Health Laboratory, I believe is what it's officially called.
I got a lot of things going through my mind right now, so official sayings, you have to excuse me if I'm missing.
Richard Sauer, I kind of wanted to ask, how important is it to get tested when you start seeing symptoms? Because as they were saying, a lot of people aren't really taking this as seriously, and if they start getting symptoms, they might just think it's a flu or a fever. So when they first start getting those symptoms, how important is it to get tested?
I think it's very important to get tested. First, to identify where the infection is, and again, to protect others, to isolate, to define where the cluster is. So, for example, what if someone doesn't get tested? They wouldn't be willing to be quarantined, and if they go out, go to work, or go to social gathering, they are able to transmit that infection to 2 person, then 4 person, then they start multiplying to 16. And it's also important, for example, if the person is living with others, it's important for them to get tested, get the results, and the others may need to be quarantined. So again, I think it's our duty to control this infection. Each one of us has a responsibility.
Dr. True, can you elaborate on how families should self-quarantine and what that looks like? Can you paint that picture for us, please?
Yeah, self-quarantine, it will very change your life, being at home, and it just means no public places, and Kathy Emmons from Public Health can chime in. It's literally staying at home, right?
Yeah, it is. It's identifying a separate area in the home whenever possible. If you've got a separate restroom that they can use apart from the rest of the family, that would be great. You want to just make sure that they're not exposing everyone else. So being able to isolate them, but still obviously care for them through the illness, but trying to move them away from the rest of the family.
And again, it's like you cannot go to grocery store, no gym, no public places. Again, it's a duty to control this infection, and we have to take self-quarantine seriously.
So the most important follow-up question, if that were you, would be, when would it end? So that would be worked out with your provider. when the chance of transmission has stopped. So you would work that out with your doctor, symptom-wise and how long it's been, and it could vary for different people based on the timeline of your illness. So you'd work that out with your healthcare provider.
So again, we do want to reiterate that if someone is not feeling well and they've had a recent travel history, and if they have a cough, then it's important to contact your provider, who will assist you to walk through that symptomology to see if it's appropriate for you to be further evaluated for the flu, to rule out flu, and then in concert with the Wyoming Department of Health to determine whether or not a COVID-19 test is in order. It's really important that we're paying attention to that as well, and in no small part because we also don't want to make sure that we're not overwhelming our emergency department resources as we're continuing to care for, general patients as well. Does that make sense?
Yeah. I think blending, two of the statements that Dr. Chu made, one about self-quarantining and for a duration to be determined by your provider, but approximately 14 days-ish. And then putting that up against his previous statement about not stockpiling. And so I think to punctuate that, really, you need to have a supply for 14 to 20 days, but not for 14 months. So there's some kind of common sense rule to apply there in terms of what you need to be safe, to be able to stay at home and have that social distancing component, again, without stockpiling or hoarding.
Dr. Chu, you had mentioned how our lives might change in the coming months. Is there like an estimated timeline for maybe, when we'll see events start picking up again, or, everything that was suspended, when that will happen?
I think I'm going to beat on the term social distancing again, because this is one non-pharmaceutical method that we can actually contain or control that graph of incidence of the infections, and that will all determine how steep that graph is. And we have not plateaued yet. The incidence is still climbing, so it's hard to predict at this time.
And another thing I think our readers are confused about, because we keep hearing, even in our comments section, like people throwing around different figures and what they occur. One of the people asked, how many Americans are at risk for contracting the virus? Some people are saying 1/3, some people are saying the majority. There's a lot of numbers flying around. So how likely is it that percentage of Americans or people will be affected?
So just remember, the virus is mainly transmitted through droplet, through a sneeze, or someone has contacted another person who did not perform hand hygiene. So I think we can prevent this from occurring. So, and again, that comes back to social distancing, which is the 3 to 6 feet away from anyone who is symptomatic, who is coughing. So that can break the transmission. So to give you a number, it's very difficult because the number will change depending, for example, in a cruise ship or very close spaces, that number might be much higher.
And then I've also seen online that, in some places, people could only get tested if they had come in contact with a person or if they had traveled to an area with a lot of people with infections. So can you elaborate a little bit, if you guys test someone with fever and they have a negative flu test, what does the Department of Health have any more guidelines that help you determine?
I think I'll give that question to Kathy.
So if a person were to test negative and they're still symptomatic and a physician or a provider is still concerned about that individual, they're most likely going to want to go ahead and do the next level testing. But like Robin said, they would then contact the Department of Health, make sure that we're working together on that to go ahead and get that person tested. If they test the person and they're negative and they're not really symptomatic, or they may just be feeling a little down, just not great, they're probably going to send them home to self-isolate and then, make sure they check back if they do start feeling worse again. But I think it's really important to recognize that we get a lot of calls from people saying, I need the coronavirus test today. And that's just not how it works. We have to do some determining what other things it could be first, rather than just jumping right to that test. That's
what some of those Department of Health guidelines would be, like what questions they'll ask? Or is it just most likely that if they test negative for the flu and they have a fever, then the test will go through?
And Robin, you can.
Well, some of the criteria has included travel history, although that's continuing to be a fluid situation.
Known contact
known
with
contact.
another laboratory confirmed positive, so somebody in your family circle, you would most likely be tested.
Yeah. And I think it's important to remember the symptoms of COVID-19 again. It's a fever, cough, shortness of breath combination. And the travel history might have some significance, but again, as Robin said, like, for example, the level 3 travel countries, China, Italy, Iran, etc. But then what if someone traveled to Seattle, Washington? I think it's still important to get an idea of where to travel or what the risks are. And the third thing you might want to ask is, were you at a party or dinner that someone was diagnosed with COVID-19? And I think that's, again, goes back to your question, why get tested? So if your friend was diagnosed, you want that friend to tell you, oh, I was diagnosed with COVID-19, consider getting tested if you're having these symptoms. Yeah.
So, hearing people who are at higher risk for complications, hear a lot, the immune compromised, as you were saying, and then, the elderly. Are young children also at risk?
From the data so far, it sounds as though children do not get severe diseases as the older adults who have comorbid conditions. So far, children are presenting with very mild symptoms. However, they are high risk, meaning that they will transmit the infection to grandma, grandpa, etc.
I guess another question I have, and I know Mr. Brunel, we touched on this a little bit about kind of, having vacant spaces in the hospital with the naderized that we can expand out into. So do you have kind of that number of total, like ICU capacity, or just what is, the capacity of the hospital to handle kind of like a mass illness event?
Sure. Our emergency room itself has over 40 beds. Our ICU has 17 beds. And we have another unit that is sitting vacant for the moment that can be brought online, rather rapidly. As you would imagine, as this, should it progress to a greater extent, other services may be temporarily suspended, freeing up other space as well. So, we have quite a bit of capacity to expand as needed.
And then kind of a follow-up to that, in like that, an event such as that, or, we have a large amount of people coming to the hospital who need hospitalization with COVID, who tested positive for COVID-19. How does the isolation procedure in the hospital work? Are they just going to be isolated in rooms, or is there going to be a specific area, or?
Yeah, so I'll mention that generally, and then I'll ask Dr. Hughes to comment more on that. We certainly have some negative pressure rooms that are specified for isolation throughout the hospital. We have some dedicated in the emergency room and in our ICU areas, which we used first. And then we have some other protocols to expand upon that, and Dr. Hughes can probably speak further to that.
So in the emergency department, we've created kind of a whole wing of multiple rooms. And we have physical barriers that you have to zip open, and we have air scrubbers in there to help them be kind of negative pressure, clean air. So once we identify a patient that could possibly have COVID-19, we put them in there, and before we go in there, we don all our personal protective equipment, and then go and see the patient. And when we come out, we doff, so that when we go see the other patients, we've made sure we're doing good hand hygiene and not have infected ourselves to spread it to others. So we have two areas like that. One with multiple rooms that is for the non-critical patients, which is probably going to be the majority of what we see in the emergency department. And then we also created one of our trauma bays to be equivalent to that with the barriers and the negative pressure and everything like that, so that if we have somebody that's in critical condition, we can put them in that area.
Do we have a plan in place for if the cases, the positive cases continue to rise, as far as a recommendation for closing school districts or closing Laramie County school districts, number 1 and 2?
So that recommendation would come from public health, not from the hospital.
Okay.
We would work with the county health officer and also with the state health officer to make sure that we're doing that in a collaborative, coordinated manner, and then with any other organizations that may be affected. So the school board, the county commissioners, whoever might be impacted by that. But that basically will set with the county health officer.
And we did have Seth from the Casper Star Tribune join us. Seth, I don't know if you can hear me. This is Kathy. We were emailing. Did you have any questions?
Yeah, can you guys hear me?
Yes, we can.
Okay. You guys partially answered this, but can you kind of talk about the access to respirators or ventilators, I should say, and if you feel just broadly you have the infrastructure to handle any cases, both locally and referrals? Thank you.
I'm sorry, that was.
I think the question was about our availability of respirators, probably really meaning ventilators.
Yes, okay. Yes, we have those available. We do have a plan in place. We do have ventilators available. We've also got ongoing personal protective equipment that they spoke to. Does that answer your question?
Yeah, it does. Thank you.
Okay.
Do you have any other questions, Seth?
No, most of the questions I had have been asked and answered, so thank you.